Hello everyone, my name is Ryan Dobbs and this is my project. It's comparing phenobarbital to the CIWA-Ar protocol for patients experiencing acute alcohol withdrawal syndrome. Just a quick little introduction to the topic. Approximately 14.4 million Americans in 2018 were seen for alcohol use disorder. These instances of alcohol use disorder can be mild, moderate, or severe. We all know about the chronic alcoholic who has the slow brain bleeds from falling all the time. The importance to advanced practice nurses is pretty self-explanatory, but just a couple more facts. In 2018, there were approximately 91,800 nurse practitioners working in acute care settings that could potentially see alcohol withdrawal or alcohol use disorder. My PICO question is, in adult patients experiencing acute alcohol withdrawal syndrome, is the use of phenobarbital effective in reducing symptoms and complications compared to CIWA-Ar protocol in regards to clinical outcomes during the acute treatment phase? Here's my case study. Basically, a 45-year-old male with a history of chronic alcohol abuse presents to the emergency department with tremors, anxiety, and diaphoresis. We already know where this is kind of going. Patient reports that he abruptly stopped drinking alcohol 48 hours ago after consuming at least a fifth of vodka daily for the past 3 years. I think many of us have seen this patient. His vital signs are blood pressure 170/95, heart rate 110, respirators are at 18, and his temp is 37.8. This patient is showing symptoms of acute alcohol withdrawal, okay? And because of that, he is either going to get treatment via phenobarbital or CIWA-Ar, and that's what this paper / presentation is trying to figure out. So here on this slide, we have the current guidelines for the treatment of alcohol withdrawal. I wanted to go ahead and slap these on here just to point out a couple things that are, I don't know, just a little questionable to me. The first thing is that these guidelines were set by the American Society of Addiction Medicine in 2015. There's a potential that there's enough literature out there now to warrant a practice change or at least a review of the literature to make sure that we're doing the right things. So just quickly running through this, basically you want to assess how they're doing using the CIWA-Ar scale. Then we do symptom-triggered management with benzodiazepines. You can consider a fixed schedule of these, but be careful using a fixed schedule because it can lead to complications if the patient is no longer receiving high CIWA scores and you're still medicating them. For patients with severe alcohol withdrawal or history of being resistant to benzodiazepines, that's kind of where phenobarbital plays into the current recommendations. You obviously have to monitor them closely. Addressing co-occurring medical or psychiatric conditions can always help in any clinical situation. And one thing that I think is lost in medicine kind of is the provide interventions to support long-term recovery. These people need help, okay? They don't need help just right now. They need life help. These people are drinking to get out of how they feel and to stop thinking about their lives. We need to improve their lives so that they can stop drinking this and exist with pleasure. So here's my literature review table. All in all, I included 5 studies. A lot of them speak to more evidence being needed. So if we go through this, I had a systematic review, a literature review, an RCT, a retrospective cohort study, and another retrospective cohort study. Many of these are showing that there just needs to be more data out there to definitively say that we can use phenobarbital instead of the CIWA-Ar protocol. As discussed in the previous slide, gaps and limitations in literature. Essentially, we need really high quality, large scale, randomized controlled trials to validate these findings. The implementation of phenobarbital as a treatment option in clinical practice may be limited by provider familiarity. Okay, so you know how it goes. You're taught a way to do something, and you kind of flow with that and use that a lot in your practice because that's what you were taught by another human being. It's important for us to continue to review the literature to see if maybe what we were taught is outdated or a little old. So, relevance and implications. Going back to our case study, unfortunately, at this time, our guy is going to get the CIWA-Ar protocol, as through the literature review and all of this, there just isn't enough evidence to say that phenobarbital alone is safe and efficable in patients with acute alcohol syndrome. So, we are going to hold off on phenobarbital for now. And I think that was a good, kind of conclusion to come to after the literature review, to just find out that there is some viability to it for patients experiencing acute alcohol withdrawal, but it still doesn't beat the good old CIWA-Ar protocol. Okay, so just a treatment plan for the case study patient. As you can see here, I tried to hit essentially all of the topics necessary for this patient. And I don't want to read all these off verbatim, but the biggest one is initiating the CIWA-Ar protocol to make sure that the patient's alcohol withdrawal doesn't progress into anything very serious. Psychosocial is another big one. I think in our addicts, we really have to start focusing on this component, even when we're doing physical health. I think that the psychological component of this is what is making their physical health bad. So we have to address that. We can't just have people come in to the ED with alcohol use disorder, treat them with benzodiazepines, and then just send them back to the street. We've got to get these people help. Lastly, some differential diagnoses for these, okay? Confusion, tremors, diaphoresis, these things can be a lot of other things. So make sure that the patient's story is aligning with your diagnosis. For my theoretical framework, I have chosen Dorothy Orum's self-care deficit nursing theory. Essentially what this theory states is that there are people, and people have a need to take care of themselves. Nurses are supposed to help people when they cannot take care of themselves, but for the APN, it's important to help get the person to a point where they can start helping themselves. So when you think of this, I want you to think about coping mechanisms, emotional regulation, mindfulness, exercise, activity, those kinds of things to give these people the tools that they need to be successful in this life and, attain what they want to do. In conclusion, the current best evidence for treating acute alcohol withdrawal syndrome is the CIWA-Ar protocol. There is nothing better than that evidence-based currently. There is some potential that phenobarbital is on the rise and could be the monotherapy for patients experiencing acute alcohol withdrawal. However, at this time, CIWA-Ar is still pretty much the gold standard. We can utilize Orum's theory to lift up our patient and try to get them to take care of themselves and be happy and thrive. I think that in healthcare, we kind of have a bad stigma about addicts, and I've seen it. I've seen it in the emergency department. I've seen it at the urgent cares. I've seen it on the acute care floors. People treat addicts differently, and it's not right. These are human beings that need to be treated with the same level of respect, humanity, and dignity as other people. I think that we really need to start giving these people a chance, even if they are our revolving door patients. And one thing that I'm going to share that I've really never shared with anybody in academia is that I am a recovering heroin addict. I had a very tough youth and I resorted to drugs when I was younger. And I was able to get out of that. And I was able to make it to where I am today. And so I just wanted to be an example for you all to see that there is promise and there is hope for these people. It's just sometimes they need other people to be hopeful for them. Sometimes you see the best parts of yourself through the eyes of others, and we need to be those people that are lifting up our addicts. And here's my reference list. I just want to say thank you all for watching this. I know sometimes these things can be a little tedious when it comes to watching everybody's PowerPoints and stuff like that. I know it got a little heavy there at the end, but I hope that what I did today was get something across to all of you and hopefully teach you a little bit about the CIWA-Ar protocol and the potential of using phenobarbital in treating patients with acute alcohol disorder. Thank you all for your time, and I hope you have a wonderful weekend.